Hello everyone. So in this lecture I'm just going to be briefly talking about the scoring systems that you can use when you are faced with a patient who has atrial fibrillation. Now it is important that when you have a patient with atrial fibrillation that you decide whether or not they would benefit from long-term anticoagulation. One of the major problems that we face as doctors looking after patients with atrial fibrillation is that they may have an increased risk of stroke in the future due to the irregular heartbeat and the risk of thrombus formation. So it is quite important that you know how to evaluate these patients. So what are the scoring systems that are currently available? Before we delve into that, let us look as to why we need a scoring system. So firstly, a scoring system is required so that we can determine the risk of stroke in these patients. What we need is a score that is simple to use and is easy to apply. And currently, there are two scoring systems that are used, the CHADS2 VASC scoring system and the Hasbled scoring system. So I'll talk briefly about each of these. The CHADS2 VASC scoring system is commonly used in clinical practice, and there are a lot of tools online that you could use that could just enter the data and get the required score. But the criteria that are looked at, or the points that are looked at, are the presence of congestive heart failure, hypertension, and age more than 75 years, diabetes, any history of previous stroke or thromboembolism or transient ischemic attacks, the presence of vascular disease, and there are other categories as well, which is age between the ages of 65 to 74 years and female patients. So as you can see, the age more than 75 years is given a lot of priority. Patients score more than 2 in this. And those who have a previous stroke or TIA or any thromboembolism are at higher risk as well, and these patients also scored 2. The other scores are all just around 1. So those who have a score of 0 don't require any anticoagulation. Those who have a score of 1, it is recommended that anticoagulation be started, or you may want to decide whether they may not require anticoagulation but may just require antiplatelet therapy. Those who have a score of more than or equal to 2, it is recommended that these patients go on oral anticoagulation provided the benefits of going on treatment outweigh the risks. Now there are a lot of limitations in the CHADS-VASC score system. For example, some papers have stated that just having a low scoring system does not necessarily mean that the patient is low risk. And in fact, those who have a low risk still have an annual stroke rate of around 1.9% per year. So as I mentioned previously, it is important to carefully weigh the risks versus the benefits before you prescribe oral anticoagulation. Is there really going to be any benefit of starting, say, warfarin or the newer anticoagulants? Or by starting the medication, do you think that the patient is going to start bleeding? So it's important that you recognize any risks before you start anticoagulation therapy. So one way to figure out whether or not anticoagulation therapy would help the patient and will be of benefit rather than a risk to the patient is using the Hasbled scoring system. Now in the Hasbled scoring system, there are a number of different criteria that are looked at. One is hypertension, that is where the systolic blood pressure is more than 160. The presence of abnormal kidney or liver function tests, each of these have got 1 point in this scoring system. The presence of stroke, any bleeding tendency or predisposition, the presence of labile INRs. If the patient is already on warfarin, is the INR up and down all the time? You can't get a stable INR in this patient. Patients who are over 65 years of age, that is elderly patients, and those who are taking some form of drugs or alcohol. Each of these score a point again. The maximum number of points you can score is in this Hasbled scoring system is 9. So if a score is more than or equal to 3, these patients are at a higher risk of bleeding with oral anticoagulation. So it is quite important that you recognize whether or not the patient will have risk or benefit. Now in clinical practice, many of us use the Hasbled and the CHADS2 VASC scoring system together when risk stratifying patients. However, some studies have shown that the Hasbled scoring system is superior to other scoring systems, so some have only limited their use to this scoring system. So here are just some of the references I used. I recommend that you have a read through these papers. They're very good and you'll learn a lot from them.